now 3 approved treatments for NMO, and they include Eculizumab, also known as Soliris, which is a terminal complement inhibitor, Inebilizumab, also known as Uplizna, which is an anti-CD19 monoclonal antibody that depletes B cells, and Satralizumab, also known as Enspryng, which is an interleukin-6 receptor antagonist and interrupts the pro-inflammatory cascade of interleukin-6. So each of these was developed based on understanding of the pathobiology of NMO that has emerged since the identification of the pathogenic antibody directed against aquaporin 4. And each targets a different aspect of immunopathogenesis in NMO. Eculizumab, targeting terminal complement, blocks the last step of tissue injury in NMO, where the aquaporin 4 antibody, having bound to the astrocyte foot process, fixes complement and causes astroglial injury. Inebilizumab, depleting B cells that are critical cells in NMO. Of course, B cells go on to produce plasma cells that make the antibodies that we see in NMO. And interleukin-6, a very important pro-inflammatory cytokine that we've known is elevated at a very high level in the spinal fluid of NMO patients at the time of acute attacks. So interrupting that blocks the pro-inflammatory cascade. All 3 products were investigated in rigorously conducted randomized controlled trials. And interestingly, all 3 products had spectacular results when it comes to prevention of attacks in AQP4 seropositive NMO patients. So this was kind of an amazing turning point in the development of treatments for NMO. We went from a point where we had no therapies that had been proven, where we were using medications, mostly broad-spectrum immune suppressants, empirically to treat our NMO patients. Many of those patients still had disease activity and frequent attacks, and in a very short period of time, because of tremendous amount of great science being done at many different groups, we went from having nothing to having 3 approved therapies, and each of those being highly efficacious. So it has been a sea change and a complete revolution in therapeutic management of this condition.